A new COVID variant is quickly spreading across the nation. The BA.5 strain is driving up COVID cases once again. According to the CDC, it accounts for 65% of all new infections in the U.S. Now, experts say it's more contagious than other Omicron subvariants, even infecting people who are vaccinated and boosted. Dr. Varma joins me now for more. He's the director of the Cornell Center for Pandemic Prevention and Response. So there are more than 120,000 cases are being reported per day, according to the CDC, and that's almost about 5 times more than what we saw around this time last year. And a lot of people think that's a severe undercount, given how many of us are testing at home, and those don't go into those numbers. So how concerned are you with this surge in cases?
Yeah, unfortunately, what we're seeing is the virus keeps finding new ways to evolve and threaten us. And much as we'd all like to be done with it, including myself, the virus has other plans. And what concerns me is really that, many of us, including people in my family, we're fatigued, and people don't feel like maintaining the same level of precautions. But we know this is a virus that causes, you to be sick. It can cause you to be hospitalized, it can cause you to be dying. And it can cause a lot of long-term disability. So I'm quite concerned that we really need to make sure Americans take the precautions that they know are effective against this virus.
Is this impacting people in ways similar to other variants have? What kind of symptoms are people showing with this particular strain?
Yeah, there doesn't appear to be anything different about this compared to the other sort of Omicron strains. So anybody who's been infected since December, you're familiar with having a sore throat, having a stuffy or runny nose, having a cough, having a fever. A lot of the same types of symptoms are presenting again. It's also important to remind people that, rapid tests are very good at figuring out, whether you're highly infectious to other people, but they're not perfect. And oftentimes people will have symptoms before they test positive. So, that's not a feature of this virus so much as it's a feature of our evolving immunity from vaccines and repeated infections.
And speaking of vaccines, there's still a lot of people in this country that are choosing to remain unvaccinated. And now some people are saying, well, I'm not sure the vaccines that we currently have will even help me with these new variants. So what is your advice these days on whether or not people should get the vaccines that are out there?
Yeah, I would really strongly advise anybody who's watching right now that now is as good a time as any if you're not vaccinated to get vaccinated. If you want to go out onto a battlefield, you want to wear a bulletproof vest. Doesn't mean you still can't get killed, but it's a way to protect you. And that's what vaccines do. And for those Americans who have gotten vaccinated, it's very important to be up to date on your vaccines. And really what we've learned about this virus is that being up to date on your vaccine means that if you're 50 years of age or older, you need to have gotten 4 shots of this vaccine. And if you're 5 to 49 years old, you need to have gotten at least 3 doses of that vaccine. And that's really going to help you. Even though the virus is evolving, vaccines have a way of giving you kind of a broader type of immunity that isn't perfect, again, but it can help you a lot better than a prior infection can at protecting you through this next wave.
All right, I want to switch gears real quick and ask you a question about monkeypox. The last time you were here on our show, it was exactly 3 weeks ago. The CDC was reporting 170 cases of monkeypox in the United States. That number is now at nearly 1,500. So is it time to sound the alarm about this?
One of the things I've been disappointed of is that the U.S. government didn't sound the alarm sooner on this, because similar to the story we've heard about COVID, the true number of cases is likely quite a bit higher because, national testing capacity has really only started to increase over, the past week or so. So what I would really emphasize to Americans is there is good news, which is that it is primarily restricted to one major population, which is men who have sex with other men, and it hasn't caused any deaths in the U.S., but many of those men are suffering. There's no reason it couldn't stay limited to that population. And this is a disease that is vaccine preventable. So as we see more vaccine capacity out there, I'm hopeful that we'll be able to slow the spread of this. I'm not sure we'll be able to stop it, but I'm hoping we'll be able to slow it.
All right, Dr. Varma, thank you for your time and thank you for all the important information.
Great, thank you.